One of my biggest things for compounding is find a pharmacy or two that you really trust and do a little bit of digging to come up with those pharmacies. The questions I have a couple go tos. I go to conferences and use these as exhibit halls for all the compounding pharmacies. They probably groan by now when they see me coming, but I can ask these quickly and they help me gauge whether this is what I would call a high quality pharmacy.
Hi, guys, and welcome to the House Call Vet Cafe podcast. I'm Dr. Eve Harrison. I'm a full-time integrative concierge house call veterinarian in Los Angeles, and I help other vets to build their unique mobile practices on their terms. This podcast is for and by house call and mobile veterinarians, so it is meant to give our community a platform to connect, to share our stories, to lift each other up, and to support each other. Most of us work solo as lone wolves, right? So for me, it's been really powerful to be able to physically hear the voices of my colleagues from all over the world and to get a chance to feel that we truly are part of a community of very real other human beings who get it. While you may be alone in that little bubble of your own vehicle when you're on the road seeing patients, I welcome you to join our community by tuning into our own podcast when you're on your way to your next house call. Whether you're a super experienced house call vet with 30 years of experience, you're a brand new prospective house call vet just looking to get started, or you're house call curious, there will be something for you in this podcast. Each episode, you will hear interviews from other mobile veterinarians just like yourself who are doing unique and innovative things, vets who are sharing their stories, their struggles and challenges, and you can also look forward to hearing valuable information and perspectives from specialists and experts outside of our micro niche. And finally, if becoming a house call veterinarian is something that you've been thinking about exploring, or you're looking for some extra support getting your own mobile practice to feel more profitable and sustainable for you, check out the information in the show notes about my course and our above and beyond supportive private community for members only, plus our monthly group coaching sessions within the House Call Vet Academy. You can also check out my free public Facebook group, which is also called the House Call Vet Cafe, the same name as this podcast, and which is a warm and cozy community for mobile vets to support each other in professional and personal development, in creative entrepreneurship, and in friendship. So thank you guys for spending time with me today. Let's dive into the episode.
Hey everyone, we have a really interesting guest on our show today. We have Dr. Lauren Forsythe with us today. She is an assistant professor at the University of Findlay College of Pharmacy. She's also a diplomat of the International College of Veterinary Pharmacists. Dr. Forsythe graduated from the University of Findlay College of Pharmacy in 2015 and completed her veterinary pharmacy residency at Purdue's Veterinary Teaching Hospital. She earned her MBA in 2024 from the University of Illinois. Congratulations. Following completion of her residency, Dr. Forsythe spent 3 years at the UC Davis Veterinary Medical Teaching Hospital as a clinical pharmacist, followed by 4 years at the University of Illinois College of Veterinary Medicine as a clinical assistant professor of pharmacy and the pharmacy service head. In addition to her teaching position, Dr. Forsythe is a co-author of the book Drug Compounding for Veterinary Professionals and provides consulting services to veterinary practices through her company, Foresight Pharma Solutions. So what an interesting human and what a cool niche that you inhabit. And I also I hadn't spoken your name and the name of your business out loud. And I like the parallels Forsythe and Foresight Pharma Solutions. That's really, really cool. I love that. So welcome, Dr. Forsythe. I'm really glad to have you here.
Thank you so much for having me. I'm excited to chat with you today.
Me too. So before we jump into all things veterinary pharmacy and compounding and regulation, what snacks do you eat in the car?
Twizzlers are my absolute favorite.
All right. I haven't heard that one before. Everyone's like, yeah, I eat granola and nut mixes and some chocolate. Twizzlers. Yeah, that's awesome. I love it. Are you
I'm really a little kid at heart.
Amazing, as we all should be. So are they like the red Twizzlers, black Twizzlers?
Oh, no, not black. Never black. Always the traditional red ones.
Amazing. I actually had Twizzlers, the black ones, just this very weekend, which is crazy because I haven't had them for years. So funny you say that. So I'm kind of curious, your path is a little bit unique and original. And on the show, we usually have house call vets, but you're interfacing with the house call vet community in a very different way and useful and interesting to us. But I'd like to just explore what was your path to becoming a veterinary pharmacist? I've never quite heard of that before.
So my parents are both veterinarians and they own their own practice. They bought it right before I was born in Western Pennsylvania. And so they were the only two vets, did 24/7 emergencies when I was little. So I pretty much grew up on the floor of a vet clinic. And I had all these different animals I showed in 4-H, and everyone said, "Well, are you going to be a vet when you grow up?" And I learned very early, nope, they work way too hard. Not for me. But I liked math and science, and the healthcare field still was intriguing. Didn't really want to go to med school and do all those years of residency and all the extra years there. So I decided pharmacy school sounded like a good idea. And when I went, my intention was to go work in community pharmacy, like at the local Walgreens. And I held that intention through about the first 3 out of 6 years of school. And then in my compounding class, which was one of my favorites, I found out from my professor that vet pharmacy was an option. I didn't even know that was a thing. And I'm like, oh, that sounds perfect to me. And I was told, oh, yeah, you like compounding? It's a big part of vet pharmacy. And so then I said, that's what I'm going to do. And at the time, there was two residency spots in the country for vet pharmacy. They ended up actually adding one at Purdue the year that I graduated. So I was the first resident at Purdue. So one of three that year.
Awesome.
And
Cool.
so that was really eye opening. It was great to learn from residency, but really kind of that fun mesh of the pharmacy world and the vet world and the gray area, the weird side of that. And I just really liked that. I never found a human pharmacy area that I loved. So I'm glad I found the vet one.
Oh, that's so freaking cool. I was just thinking back to my pharmacy classes in vet school and thinking, like, what's weird? Like, it was kind of boring to me. Like, pharmacy never really caught my eye, but the parts of our pharmacy class, and I think it was a pharmacy class actually, where we're talking about toxicology as well, like included, was the parts where we were identifying plants and mushrooms. I was like, wow, in pharmacology, that's where I learned, like, now I'm super into like foraging and mushrooms and plants and medicinal plants. And I'm like, oh my God, I actually learned this in vet school and like rhododendron. Like, I didn't know what rhododendron was before. And, there's just like foxgloves, digitalis, right? So now I find in my foraging, I'm like drawing upon information I learned in veterinary pharmacology, which is so crazy to me now. But it's kind of morphed basically in terms of my interest. And now, like, I'm really excited to be talking to you because, like, I have a great interest in pharmacology. I think we all do as veterinarians. Like, it's the bread and butter of how we help our patients with medicine. And so I thought it was really cool how you had this interest in compounding because, particularly for animals, I imagine for children or maybe elderly people, compounding might be important. But for animals, compounding is like key. It's absolutely key. So I kind of wanted to talk to you about compounding veterinary meds and how that might be relevant to a house call veterinarian.
Yeah, you're exactly right. Compounding is so important in veterinary medicine. And at one point historically, before manufactured meds were super common, compounding was the main role of the pharmacist on the human side. But then we got manufactured meds. And so outside of pediatrics, hormone replacement therapy, and a few other niche areas, compounding isn't all that common in human medicine. But veterinary medicine, we can't live without it. And for our small animal patients, we reach for them all the time because with the wide species variety we see and the size variety within each species, we just can't have all the medications, all the dosage forms, all the strength that we need to serve all of our patients. So we have to have that ability to make things when manufactured products basically don't meet our needs.
Yeah, absolutely. And so I would think that for the veterinary patient, for me, when I reach for compounding, which is like every single medication, like formal, like either making it into a liquid or making it into a treat or making it into a small capsule, or the reasons that I reach for compounding are just ease of administration to the animal, like increased compliance for the client to give medicine to the patient. And compliance is such an issue, not only because people are dumb sometimes and just don't do it, but like if you're fighting with the animal and it's a every day or twice a day or 3 times a day, a terrible experience for the animal. Now, why would a person comply with that? Yeah. So, like, I'm really curious to hear a little bit more about your experiences in veterinary compounding and how you've seen it either help or any experiences you've got that seem interesting to you.
So the area that I really fell in love with veterinary specific compounding were those transdermal medications to make things easier to give to cats. So along your lines of let's make it easier to administer. And as a pharmacy student, when I was on my clinical rotations, I learned about the aspects of transdermals and I went, oh, I want to learn more about these and do more with this. Because vets would put everything across the skin if they could on cats. But some of it works, some of it not so much, some of it could be harmful. And so trying to sort through that is complex and figuring out what is a good transdermal option. Methimazole, tons of data. There you go. That's a good transdermal compound. But everything else is so vague. And we have varying levels of evidence to support that. So I dove into that. And for my residency research project, I said, I want to study a transdermal. And I decided fluoxetine was going to be my drug of choice because with Purdue in the early 2000s, I believe, they had done a bioavailability study of transdermal fluoxetine that looked that at even 10 times the dose that you would give orally, it still wasn't coming anywhere close to the same blood levels. And I said, okay, well, that's a single dose study. Okay, obviously not absorbed as well as oral, but we know transdermals can sometimes increase absorption over time. And we know that behavior meds are not a one and done dose. It's an extended period, and a single dose isn't going to get you the effects you want. You need that build up over time. So, what would happen if we did it over an extended period? We obviously are going to need a higher dose. And so, I did my study where we had healthy cats, and they were either assigned to get 1 mg per kg dose orally or a 5 mg per kg dose maxed out at 25 milligrams per cat of the transdermal and have that once a day for 60 days. And we did blood levels at various times to monitor drug concentrations. And we did them at, I think, 5, 14, 30, 45, and 60 days. And we found after 14 days, there was a statistically significant difference in the blood levels of the transdermal group versus the oral. Now, they were still there, though. It was getting absorbed. And we continued to see a lower level, but still level. Like they were there. The drug was definitely in the system. So it does tell us it gets absorbed less. You can safely do a 5 mg per kg dose on a cat and be substantially lower than you would be with a 1 mg per kg oral. So we know we can go higher now. What we don't know, because I was only a 1-year residency, so could only do so much, was what are the clinical effects? We don't have target blood levels for that drug. So did we really need the super high levels we had with that 1 mg per kg dose? Would a half a mg per kg dose be more comparable? And would that have aligned? And we don't know that still. So there's still some unknowns, but doing that research was really interesting. And so then I haven't done any more clinical studies on transdermal since then, but I have done several articles compiling current data, what's there, what would be recommended or not, in my opinion. So I've gone through and figured out that the transdermal drugs that I would probably reach for at this point, methimazole, fluoxetine if you can monitor sufficiently and you've failed oral, the commercially available mirtazapine, the Mirataz, and potentially phenobarb. That one, there's some data. You have to dose it a little higher. I believe they did a 9 mg per kg dose, and it was only a 14-day study. So it's a little questionable, but they did in that study with the higher dose get it above our therapeutic goal level in cats. So I think that could be a possible option. Again, needs monitoring, and you can do blood level monitoring there. I would not do steroids, transdermal. Steroids really don't get absorbed well, but they do cause cartilage atrophy where the ears will just start to fold over, and it doesn't appear to be reversible. So that's one of my big no's. And then anything antibiotic wise, because if you are trying to put it across the skin, probably not getting absorbed well from the couple studies we do have, and therefore not treating your infection, but potentially causing more resistance to that antibiotic. So that's one of those I'm like, do not put antibiotics across the skin. That's just not a good public health decision.
No.
But that's one of my favorite areas of compounding. There's all sorts of other fun ones like treats, and those are kind of interesting too. But I like that transdermal stuff that doesn't really have one right answer. We don't have everything neatly out in studies to tell us what to do.
That's absolutely fascinating. I love me some fluoxetine. Let me just say that. And I think the transdermal use of it is potentially very important because fluoxetine tastes like ass. Ask me how I know. It tastes really bad. Um, and I think animals agree. So I'm super excited for more information to come out as far as like what blood levels we do need to be therapeutic in a cat. And it's such a subtle, it's like, this is behavior. This is like mind, internal mind. Like, you can't ask a cat, do you feel better now? Like, how about now? Like, sit down on the couch. Let's hear how the fluoxetine is working for you. You know? So I think that's like absolutely huge. And yeah, good call on the antibiotics. Like, definitely don't want to be messing around with subtherapeutic doses of that.
Hi, my name is Jonathan Lau. I'm the founder of O3 Vets. One of the challenges of being a mobile veterinarian is that you have a more limited toolbox to draw from. At O3 Vets, we put a powerful tool into your toolbox by providing ozone therapy equipment designed specifically to help the mobile veterinarian treat those tough cases. Ozone works as a redox molecule to help decrease inflammation and improve cellular communication. This has an incredibly beneficial effect on a variety of conditions, as demonstrated through the hundreds of scientific studies available. If you would like to join thousands of veterinarians who've experienced the power of ozone therapy, you can visit o3vets.com or call us at 517-925-8148. If you mention this ad, you'll get access to our online training course with the purchase of your ozone equipment.
I'm curious, what about gabapentin? Do you have any thoughts on GABA? Like any of the other behavioral meds like amitriptyline, gabapentin, like any sedating? Oh, like there's Cilio. That's a whole other thing, right? That's like not even transdermal, that's transmucosal, but curious your thoughts on the behavioral drugs.
Amitriptyline, I've heard anecdotally, works at about a 7.5 mg per cat dose. So you have to go a little higher than oral. The oral dose, I think there's one study that shows it's not terribly effective. So that's why you have to go a little bit higher. I've not seen studies showing that, but I've heard multiple people say it does seem to work. So I think that's a possible option. Gabapentin, there's a couple studies. One that was in cats, it basically showed it wasn't really getting absorbed. There was another one that was done by a different group, and they were using feline skin models. And theirs showed that it did have the potential to get absorbed. So I don't think we know completely, but I'm going to err on the side of probably not really getting absorbed transdermally, especially enough to be effective for what we need it for. Now, as a drug, though, for anxiety, I do love it for chilling those cats out. I did a study on that one when I was out in California, and the resident and I that were doing the exams for these cats, they were crossover. So they'd have an exam with gabapentin on board and an exam without, and they were randomized, and we were both blinded. But we would guess afterwards if we thought the cat had had gabapentin or not. And we were right 100% of the time once it unblinded. It was so obvious, the difference.
Oh, so obvious. I mean, gabapentin is like the lifeblood of a house call vet. Like, we do what we do because of gabapentin. Thank you to the gods of gabapentin. So, I mean, most of the time, my patients will just take it, even like open capsule in the food. So it's like usually not too much of a problem. But for the cats that like just will not take meds, will not be touched, I am curious if there's like some much higher dose of gabapentin that could be used transdermally. But I mean, even transdermals, those kinds of cats don't want their ears touched even. So it's a tricky thing, but that's so cool. Literally 100% of the time you could tell the difference. Like, that's no joke. It's great.
That touching the ears thing is one that I always try to, when I talk to clients about transdermals, caution them. Yes, transdermal is generally easier than oral for the cat, but that does not mean that they're going to just lay there and purr while you rub their ear. I had a cat that needed a medication, and I did do the transdermal with her. There was no way I was getting anything oral into this cat. She was awful. And so the transdermal, I could apply it. So it was an improvement. I was still sort of sitting on her to do it. And eventually, after several weeks, got her to the point where I could lure her over with treats and not have to use my full body weight to restrain her.
Nice.
But
Hey, that's
she never loved
it. Oh, love it. Oh my gosh. This is really fascinating information. So I know that you have a little bit of background also in like the regulatory medicine, like DEA controlled this and that. Do you have any just like, I don't even know what to ask you, but do you have any sort of general wisdom, like anything you want the vet community, especially maybe the house call vet community, to know about regulatory stuff?
Controlled drugs. I mean, there's lots of other regulations that apply, but controlled drugs are the biggest ones. They're going to be the ones that probably have the most severe consequences if you don't follow them. And ask questions ahead of time. If you're not sure about something you don't understand, the DEA field agents, your local agents, in my experience, are very helpful. They want you to be successful. they don't want to have to come in and cite all the problems. So they're happy to answer questions, and I found them very beneficial. Some people I know, like, I don't want to call them, I don't want to end up on their radar. And so I've also noticed, though, that the state vet med associations, sometimes as a service to their members can contact them, ask questions. And if they haven't already obtained the answer to that, they'll contact the DEA and say, a anonymous vet in the state has asked this question. So it's coming from the state vet group, not from an individual doctor. And then they'll let you know what they find out. So that might be an option too, depending on what state.
This is fascinating. I have a question that has not been thoroughly answered, or at least answered in a consistent way by anyone that I've asked. I have a few of these that I want to turf on to you. For a house call vet, for example, if you have a DEA license, can they come in and do a random inspection to your home at any point in time without a warrant or without giving you a heads up?
If that is where your DEA license is registered and you have drugs that you store, so you have a stock of controlled substances, then yes, they could. You can register your DEA license to be a specific part of your home. And so, you only store your drugs in a safe in your office, in your home. You can register it specifically to the office in your home so that it says, I only have drugs here. Now, they find drugs elsewhere, that's a whole other charge. But if you truly do only keep them in one spot, you can do that to put the rest of your home off limit. Because yes, they can come inspect any registered address.
Amazing. Okay. That's very, very helpful. And they can come without notice. They're like, we're here for our routine inspection. Fantastic. Okay. Wonderful. I love that idea about registering the specific room of your home to the address. That's amazing. And then another question that comes up pretty commonly is, say I'm a relief vet and I'm also a house call vet, and I prescribe DEA controlled medications through my house call practice and also as a relief vet. Do I need two separate DEA licenses? That's really, really common question.
So the relief vet stuff, I've heard that there are some attempts on the federal level to clarify some of the things because nothing is clear in that world. So I'm going to explain the background of my assumptions I'm making in my answer here. So I'm assuming that for your DEA license and how you use it for your house call practice is that you have some controlled substances potentially that you stock, have on hand. You take those with you to your appointments. You might use them on animals. You may also dispense from that stock or prescribe to an outside pharmacy for your house call client. When you do relief work, you're not bringing your own controls, but you might still prescribe for the patients that you see.
Okay.
And as long as that is the case, you do not need different licenses. The licenses, a lot of it goes with the location you're storing your drugs. So for your house call practice, you're storing those at your home. You're taking them as an ambulatory vet would, doing the calls, bringing them back to store at that location. You can write prescriptions from any location. So if you're seeing patients as a relief vet someplace else, don't take your drugs with you. Use the ones the practice has while you're there, but prescribe using your own DEA license, the same one you use for your house call patients.
Fantastic. Oh, that's such clarity. I love that. Thank you. I've heard many different answers, and that's the one that is the most pleasing to me. Oh my goodness. That's amazing. Do you have any other ideas or advice for how either compounded medications or working with pharmacies or anything like that might be helpful for a house call vet or a future house call vet? Any tips, ideas, wisdoms?
One of my biggest things for compounding is find a pharmacy or two that you really trust and do a little bit of digging to come up with those pharmacies. The questions, I have a couple go-tos. I go to conferences and use these at exhibit halls for all the compounding pharmacies. They probably groan by now when they see me coming, but I can ask these quickly and they help me gauge whether this is what I would call a high quality pharmacy. So first one, I want to check regulatory compliance. So I ask, would you compound 100 milligram cyclosporin capsules for me? And I choose that because cyclosporin is available for veterinarians as a topica. It's expensive though, especially if you have a big dog. It's also available on the human side as a generic. Jury's out on if that works, but it is there as an option. But if nothing else, we know the veterinary product works. So if they are compounding a duplicate and it's not because the other ones are on back order, that's not legal. You cannot compound just because something's cheaper. You have to have a clinical reason. So you can't duplicate commercial products unless you can say, well, we're making it for a patient who's allergic to an inactive ingredient. And so if they're going to say, yeah, sure, we'll make that, that's ooh, no, that's not legal. So that's a red flag. If they'll say, well, we can't make that because we can't duplicate it, but I could do a 98 milligram one for you. That's even a bigger red flag because that means they know the law and they're just looking to circumvent it. 98 milligrams is not significantly different from 100 because compounds and commercial products have a margin of error they're allowed to have. So commercial products could be plus or minus 10% of the labeled strength. So that 100 milligram Atopica capsule could actually be anywhere from 90 to 110 and be legal. They're usually pretty close when they do that. They're closer than that. They're not usually at the edges, but they could be. So anything in that range for compounding is not going to be a significantly different strength. The other question I ask is looking at clinical judgment or at least thought process on putting some effort into that. It drives me crazy when a pharmacist says, well, I made it because the vet asked for it. I assumed they thought it would work. But the vets are over here saying, well, the pharmacist made it, so I assumed they thought it would work.
Yeah.
And so I want to make sure the pharmacist is at least putting some critical thinking into these requests before they just agree. So I asked, will you make enrofloxacin transdermal? And there are some big compounding pharmacies out there that have it on their list of things they make. And so there's nothing illegal about making that. But it's not a good idea. There is a study on enrofloxacin transdermal from 20-ish years ago that shows it doesn't really get absorbed at all. But also antibiotic, highly important on the human side, all these antibiotic stewardship considerations, transdermal absorption questions, it's just not a good idea. And I would think a pharmacist would be like, I'm not sure about that. I don't think that's a great choice. So that's me checking their clinical side. So those are the two questions I ask to make it a quick and easy. Is this a pharmacy I want to trust and work with?
That's amazing. Okay, so now I'm going to ask a question that may be a little like taboo. You don't have to answer it. What do you think of the big online pharmacies that tend to undercut veterinarians? Are they, I'm not going to name names, but I think we all know who they are and their relationship to most, veterinarians. Do you have any thoughts, questions, concerns, ideas that you might like to share on that subject?
When we're talking about non-compounded products and the online people that are selling them, they're just super annoying. There's nothing illegal. The big ones are pretty legit. There's plenty of bad players in the online field. So I always caution clients, don't just go find the cheapest product. But the big name ones you're talking about, they're legit. But I don't like how they push on the clients. I don't like how they time, like there are many, many, many repeat. You need to authorize this. Pushiness, some of those just grate me the wrong way. But I don't think it's really necessarily worth the effort to fight a huge battle. I've talked to some vets who they're like, well, for some of the flea and tick preventatives, we can actually price comparative to them and not be losing money. And so being able to do that, I think is helpful, or getting it in-house, because when the clients have to start paying shipping, well, the list price looks cheap. You add in the shipping and the other stuff, and then it's not so great. And I think a lot of clients do want to support local if they can, but there's some that they're just going to find the cheapest. And it's sort of, okay, I'll write you a prescription, take it where you want. Here's my evaluation. They'll probably tell you where they want it. So you can say, okay, that seems legit, or probably not.
Totally. Yeah, that's very fair. In terms of regulatory stuff, in my understanding, there's a state by state variability on whether you are required to fill a prescription at the actual pharmacy of choice of the client. And so there's like house call vets who will sort of like formally refuse to fill at this pharmacy, or will say, well, hey, if you want to fill there, here's my prescription, but I'm not going to interact directly with them. And I find that really interesting. And also just like the variation between states, what the regulation is around that. Do you have any thoughts on that subject?
So the regulations in the states that have them stem from the Fairness to Pet Owners Act history, which I think that started about 2011, where the big pharmacy chains were pushing that vets should have to offer clients written prescription. AVMA absolutely opposed it, pushed back. It never passed. It got reintroduced several times, but hasn't passed, likely is not coming back again. But some of the states jumped on board and said, well, we'll just pass our own. So you're right. Some states say you have to offer a prescription. Most of them, if they say anything, they say if the client requests one, you have to follow that request. But then even if your state doesn't say anything, AVMA's Code of Ethics says that if a client requests to fill their meds someplace other than at your practice, you should honor that request. And so it's a good practice to do that. Now, the questionable pharmacies, I'm not going to interact with those certain pharmacies. The stance that I give to vets, because I do understand that side of it sometimes, and I do think it's sometimes justified, is that you can write a prescription, hand it to the client. If you have misgivings about whether they're getting legitimate meds, like you're like, I don't think this is a legit pharmacy, share those with the client, document that you share those with the client. And if they still choose to go there, that's their choice. If it's just you don't like their business practices and you don't like interacting with them, give them the prescription. They can take it and they can go get it wherever they want to have filled. And that is their choice to take that written prescription someplace else. You do not have to say, I will call it in, I will fax it in, I will go through all these hoops to get it there for you. You can just hand them the prescription to do what they choose with.
Brava. Yep. I think that's the that's the ticket right there. I think that's a lot of house call vets really struggle with this particular issue, and just knowing you can just hand them the script and have it be off of your plate. It's great. Yeah.
Make sure you make a copy of that script before you send it, and so that it's in the medical records. So if something goes wrong, you can say, here is what I wrote on that prescription.
Yeah, screenshot that shit, right? Amazing. All right. Well, this has been absolutely mind-blowing. I didn't even realize how nitty-gritty detailed information you had in there. And so thank you very, very much. I think our house call community is going to really benefit from some of the wisdom and information that you just shared. And I'm just so glad that we connected back at AVMA last year and that we were able to follow up in our conversation. Is there anything else that you'd like for my community to know about you, or that you'd like to share, how they can reach you if they've got questions?
Yeah, if they want to reach me, my LinkedIn is always a great option. I'm pretty reliable on that. And my username is actually Lauren Eichstead because it has my maiden name in there still. But I have the Forsythe added in too, so you can see both. And I have a website, ForsightPharmaSolutions.com, which is my consulting business. And so I'm happy to help anyone answer questions. The vet pharmacy world, we're a tiny little group, but we have this unique subset of information that isn't really taught to human pharmacists or to vets a lot of the time. And so we sort of speak both languages, which is fun.
Exactly. Yeah, it's been super fun. And you're so quick with the knowledge. I asked the question 5 seconds later, it's 10 studies that you've cited and the legal code of it. That's awesome. All right. Well, thank you so much, Dr. Lauren. I really appreciate your time and looking forward to talking to you soon.
Thank you so much for having me. This was fun.
Super fun.
Thank you so much for listening to this episode of the House Call Vet Cafe. If you enjoyed this episode, then hit the subscribe or follow button on Apple Podcasts, Spotify, Google Podcasts, YouTube, or wherever you listen to podcasts so you never have to miss an episode. This podcast is made specifically for you, so don't be shy if you'd like to reach out and let me know your thoughts on this episode. You can find me on Instagram and Facebook as the House Call Vet Academy, where I also share more valuable content. If you're interested in learning more about consulting for house call vets or the House Call Vet Academy online course and community, please click on the link in the show notes. Have an amazing rest of your day, and I can't wait for you to join us for our next episode of the House Call Vet Cafe.